I mean, the best is when you have patients coming back and they tell you that you've changed their lives.
Even weirdly enough, in the US, you could be a doctor and do anything you want in your office. So I could do a lung biopsy, do brain surgery in my office. Now, of
Mhm.
course, I'm not going to do that,
And if I
but
can be part of that journey to help them with their life in a fuller way, then that's a win.
and one of the very fun things about plastic surgery is not just innovation and continuing education. I do feel that plastic surgery, compared to so many other fields in medicine, it's pretty, like for medicine, it's rapidly changing. Where
Mhm.
stuff that we were doing 10 years ago, 5 years ago, we're not doing that today.
The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Welcome back to the Beauty Scientists. We are board certified plastic surgeons that love talking about everything beauty, surgery, non surgery, all of it. I'm Dr. Kristy Hamilton here with Dr. Roy Kim, and today we're talking about the journey towards becoming a plastic surgeon and all that's involved.
Yeah, so this is a fun topic because plastic surgeons definitely have a common path, but we do have definitely different stories about how we decided to become plastic surgeons, our training, and so forth. So it's a question we get asked often, especially by younger people. So I'm eager to learn more details about your surgical journey.
Yes, and what it's like. And we've talked in the past all the differences between being a plastic surgeon and a cosmetic surgeon, which is very different. And so this discussion will allow you to understand why becoming a plastic surgeon is so important, the difference too. So first is education. So it's you and I have gone to school for a very, very long time. And that's the foundation of the knowledge when you're coming in for your consultation to see a plastic surgeon. That's what we're relying on. So everybody 4 years of university, so college level education, studying whatever you want, but certainly pre medical courses too. Then 4 years of medical school. That's where you become a doctor, but not a surgeon. And then after that, it's anywhere from 6 to 8 years or beyond to actually become a plastic surgeon. And you can do a direct plastic surgery residency, which is what I did, which was a accelerated or integrated 6 year program. Did you do general surgery first and then plastic surgery, or did you go straight into plastics?
I'm older than you, so there were very few integrated programs. I didn't get into the two I applied to, so I did general surgery. And I actually got lucky. I actually only did 3 years of general surgery as opposed to the normal 5 years.
Okay. And it keeps on evolving too. I think the trend is there were a sizable number of integrated programs when I was applying, but now I think there's becoming fewer and fewer and fewer of the combined where you do the general surgery first and then plastic surgery. So that is when you're working the no more than 80 hours a week, but we all know that's not true. It's like 80 hours, 100 hours a week. You're living in the hospital, basically living, breathing patient care, learning how to be a surgeon, learning how to take care of really sick patients, critical care patients, people who've been in car accidents, just unwell. And then as you master those skills, then you start learning the principles of plastic surgery. But at first, it's just knowing how to take care of sick people. And that's why we maintain our hospital privileges. We know how to take care of like very, very ill people. And most of us now in our practice take care of like healthy people, particularly you and I who do essentially aesthetic only plastic surgery. But that's how we can keep you safe because we know what to look out for and how to manage problems if they arise.
Yeah, I do think that general surgery training is important. The question is how much of it is important. So, specifically, to do 5 years of general surgery means you do full 5 years and you're qualified to take care of trauma patients, ICU patients, and you do the bread and butter of general surgery, including hernia repair or intestinal surgery. Obviously, some of this is crossover to all types of surgery, but a lot of it is not really applied to plastic surgery. This is why we have combined programs. So you spend the vital time with sick patients in general surgery, and then you have hopefully a little more time honing your plastic surgery skills. Because as you know and I know, plastic surgery is a huge field, operates on young and old, all over the body, reconstructive, cosmetic, and stuff that's sort of a gray area in between. And that's where the fun is, I think, in terms of our training.
Yes. And so we spend more time learning cleft lip and palate, for craniofacial repairs, like burn reconstruction, trauma reconstruction, patients who have cancer and they have to have large portion, maybe their jaw removed or their breast. So we know the principles of literally having to like recreate something from scratch when it's been removed. And so that is how you spend the balance of your training. And some surgeons will even go on and do additional training beyond that in the form of fellowships. But all board certified plastic surgeons have at least completed integrated plastic surgery 6-year program or done general surgery and then dedicated years of plastic surgery fellowships afterwards. And so that's really important. And that lays the foundation of your whole perspective. And it really, I mean, I think all surgeons say this, but those are very formative years. I talk about it now. Sometimes patients are like, oh, how did you have a baby and you have your practice and then you seem like still like happy and you're running around. And I always say, yes, it's life is busy, but nothing will ever be harder than residency was, so even with a newborn and running a practice, like I still got more hours than I ever did in residency. So it takes the mental fortitude, like physical fortitude to stay awake and stay alert and focused. And I do, like, residency was hard, but I appreciate it more and more as time goes on because it teaches you your true limits, I think. And so when you know where those are, and I think where we function is well within our limits now, that's valuable. And you know that you can do more if you need to.
Absolutely. And, a day in the life of plastic surgery training is the earlier you are in your career, you're sort of the lower person in terms of the team, and you may have to do more of the admin work, but you're still learning stuff. And as you get higher and higher, you can actually start being more independent, start thinking, start consulting. And of course, you still run everything by the head faculty attending plastic surgeon, but you're actually seeing the patient, making decisions, coming up with a plan with the faculty member, and then executing that plan. And that's really part of daily life. The other thing, of course, as you said, there's so much in plastic surgery. There's reconstructive, there's burn care, there's stuff where there's burn care, resection of cancer, pre-flaps, reconstruction, making it functional, all that stuff just for the head and neck area. Well, of course, we apply that to the extremities, the body, to breasts. And then the next step, of course, is to make it look good. It's not just good enough to make it functional. You actually have to make it look normal. And then the next step is, well, can we enhance it? We don't want it to look normal. We want it to look better. And that's where aesthetics comes into play. So for plastic surgery, it's such a huge field. There are so many little, little subspecialties within plastic surgery. Plastic surgery is a little odd because we can touch so many other different specialties. In other words, sometimes as a team at the hospital, we work with neurosurgeons, orthopedic surgeons, trauma surgeons, vascular surgeons, the list goes on. And we take little bits of it from all these different specialties and apply it to our own lives and our own, I would say, fun, because I love operating.
It's the joy, right? I think of it like we're the ultimate problem solvers, right? Other services will come to us like we've got this wound or this patients lost part of their, we have to cut out like part of their arm bone, and like how do we do, like we can take out the cancer, but then how do we leave them with like a functional limb? So there's so many different or a baby was born this way, what can we do so that she can have a normal life, or as as close to normal as possible? And every case is a little bit different because every cancer is a little different, every accident, every congenital issue, and babies that are born, like they're all unique. So we dive into our toolbox. That's where our training comes in, and you're like, I've seen something maybe similar, I can apply this principle, and then you get to come up with something unique for that patient. So I love that. Every day is different. Like truly, there's no, even in aesthetics, it's no facelift is the same. No rhinoplasty is truly the same. Breast reductions, even though we're doing some things in a somewhat repetitive way, but that's how we hone our skills too. So what's a typical day look like for you now as a attending?
So as an attending, I do have certain days that are reserved for seeing patients and certain days in the operating room. I tend to like operating just all day or most of the day, as opposed to operating sort of a little every day. That's just my preference. And certain days when I see patients, I'm seeing new patients, I'm following up with old patients, I'm actually doing injectables or small procedures in an office setting. And then certain other days are reserved for the operating room where we're doing everything and everything. For the most part, it's outpatient, as probably your practice is.
Hmm.
Most plastic surgeons are probably an outpatient or shorter operation or not quite as medically unstable patients, but I think that's the nature of plastic surgery.
Yeah, I agree. So my practice is 100% outpatient as well. I also prefer to like do clinic on clinic days and surgery on surgery days. And then I do local anesthesia cases one morning and then a short clinic that follows. So I like keeps it structured, helps ensure that I'm not running behind in surgery, hopefully, and then having patients waiting for me on the other end. And I like that structure. So I think structure like really helps me be efficient in my day and I think take best care of patients. So, and now that we are running our own practices, we can create that structure, which is nice. You're not at the mercy of like the hospital OR schedule. So that's really, really good. What do you think is the most difficult part of being a plastic surgeon?
I think, first of all, you have to be crazy enough to do it because it is a lot of work. There's no way you can, like, someone can force you to do this. You have to really like it to love it, and you really love it. It's a lot of work in training. It's a lot of different work when you're out on your own because even if you join a group or hospital, you still have to sort of carve out your own niche. If you're starting out on your own, then suddenly you have to learn about small business and admin and marketing and hiring people and all that stuff. So that's a completely different skill set that we're not taught in college or medical school or plastic surgery training. And it's like running a small business. And you have to be physically tough, maybe not super tough, but you have to have endurance, stamina. Most of the plastic surgeons I know of, actually, virtually all of them, are high energy people who are motivated, who want to fix problems. And
Mm-hmm.
mentally, you have to be tough because you have to deal with difficult cases. Sometimes you have to deliver difficult news to patients, or sometimes you're just having a difficult time with HR issues. So those are the things that I think they're looking for in plastic surgery. And both you and I have been through the training. What are some of the awards that you've really, really loved about plastic surgery?
I mean, the best is when you have patients coming back and they tell you that you've changed their lives. In residency, I mean, it was so tangible, the reconstructive patients. It's like, okay, they couldn't walk. Now you help them walk, probably in conjunction with an orthopedic surgeon, but saving somebody's hand, piecing someone back together, reconstructing their breasts, after breast cancer. I mean, those are just so powerful on the aesthetic. And now when patients come back and they're like, I've always hated my nose. Now, because with this new nose, I just feel like confident enough that I went for that promotion, or I don't like, I'm not shy anymore. Like it's amazing how these sometimes very small changes can really enhance someone's confidence. And so I mean, that's the best for me, is just like a patient coming back being like, this changed my life. Because everyone's different in terms of what that thing is. And if I can be part of that journey to help them with their life in a fuller way, then that's a win. My second favorite thing is just my team, like building our team. I love the women I work with. I think they're just phenomenal humans, and getting to like create this practice as it continues to grow. And we're always trying to innovate and take better care of patients. That's been really rewarding too. And I think you and I both just love operating as well. Like I'm so grateful I get to do what I do every day. It's like intellectually engaging. I love it. I love getting to use my brain that way, and then like also my hands.
Yeah. One of our mentors, Dr. Rorik, has always said, the anatomy is always the same, but every patient's different. So you've talked about, how each approach is a little different. This is how we're doing a facelift or rhinoplasty or whatever, and it's the same procedure, but it's not the same procedure because everyone is different. The other issue is in terms of communicating, because I think when you have a problem and there are a couple ways to fix it, well, that's actually weird in medicine. Most of medicine is very algorithmic driven. Like, you have pneumonia, we're going to fix it. That's not true in plastic surgery, where you have a problem. Well, there are a couple ways to fix it, and none of them is better or worse. It just depends on your situation and surgical preference. So, if you could expound upon that as well as some of the ethical dilemmas regarding that.
Yes. And so that's part of the conversation when patients come in. It's like, look, there's woman coming in for breast rejuvenation after having kids. And it's like, well, first off, we got to get in your head. Do we want the breasts, like, do you want them bigger, smaller, lifted? Do we like the shape we have and just want to change volume? Are we really trying to adjust that? So there's so many things that we can do. And, I think thankfully most of our patients are very, very reasonable. They want natural results, things that make sense. Ethical considerations, if someone comes in, they're like, I want to have breast implants so large that I like fall over, then, I have to explain to them like why I can't do that for them. It's like, one, it's, first, do no harm as a physician. And rarely, but sometimes we end up in situations like that. We have to explain what is possible, at least at this time in medicine, both from a anatomical perspective and then also just from functional perspective, like what we can do. And just because we can do something doesn't mean we should do it. That's a Dr. Roerickism as well. So sometimes those are difficult conversations because patients may not understand initially why that is, but I spend a lot of time with them just to make sure that they understand that I want to give them what they want, but it has to fall in that realm of what is possible and safe. So within that, we'll hone in on the specific look that they're going for, but that's also something that should be comforting in a way to them, is that I'm not going to let them do something that doesn't make sense.
Yes, I totally agree. And I do think the plastic surgeons are better at communicating. Even if you're at a university setting, you're in a group, it's all reconstructive. We have to be able to communicate to patients what's possible and what's not, and really meet what they're envisioning in their brain and expectations and what we can deliver.
Yeah.
Um, yeah,
And the starting point is so important. Everyone's anatomy is different. Everyone's starting point is different. Our tissue qualities are different. Age can be different. Just your frame or your figure, your facial anatomy. So that is why every consultation is unique. And you can't just come in with a picture of a supermodel and be like that, because we want to choose a body type that's like similar to yours. And some people we can create more of an hourglass. Some people are straighter, but it's about adjusting what we're starting with.
yeah. And one of the very fun things about plastic surgery is not just innovation and continuing education. I do feel that plastic surgery, compared to so many other fields in medicine, it's pretty, like for medicine, it's rapidly changing, where
Mhm.
stuff that we were doing 10 years ago, 5 years ago, we're not doing that today. So, how do you keep up with all of the latest innovations, technology, FDA approvals, and all that stuff?
So you and I are very active in our societies. So I think that's one way we are like keyed in with the other plastic surgeons that like to stay very academically minded, involved in writing journal articles, reading the journals, going to meetings. I learn a lot from my colleagues like you, just finding out what's going on in the United States, also outside of the country. Outside of the country is really interesting always because they tend to test out some of these new technologies first or new modalities before they get FDA approval, because that's a very rigorous process. And that's part of the fun too. It's like, how would it be if we were doing the same thing forever and never changing? Like, we're always trying to come up with a perfect surgery with zero complications. I mean, like, that's the dream, right? And we're not there yet as a profession. So there's always room to grow.
Yeah, yeah. And then, just in case for the people out there, societies really are clubs, but it's a pretty open club. I mean, you just have to be a plastic surgeon board certified and you're in the club. So every medical surgical specialty has them. Ours is called the what? The American Board of Plastic Surgery is the group for board certification. There are a couple different societies where we just meet once a year for a big meeting where we can network, see our old friends, but more importantly, go to lectures, go to breakout sessions and small lectures, like small groups or large groups, and we're learning about the latest in innovation. And I've always enjoyed it. I've always enjoyed seeing you and my other friends, and I also enjoy learning stuff.
Yes. And I love the debates because I mean there are some topics where we feel like we have them figured out. Like it's like a good operation, reproducible, good results, consistent results. And then there's other operations that like people are like it's almost like they're lobbing things at each other across the stage. Like they're like so like it's there's drama in terms of people feel very passionately that like one approach is better than the other. And it's really great that we have that kind of friendly professional debate because it shows us the operations that we're still like working on perfecting. And
Yes.
it's always fun to see people getting like kind of fired up about what they're passionate about. Lifelong
Yeah.
learning for sure.
Yeah. And one thing we forgot to talk about, but is important, is Okay, what's board certification mean? So in other words, you can, weirdly enough, in the US, you could be a doctor and do anything you want in your office. So I could do a lung biopsy, do brain surgery in my office. Now, of
Hmm.
course, I'm not going to do that, but technically I can do it within the scope of my office. And I just have to be an MD, medical doctor, not even necessarily with any additional training. Now, of
Yeah.
course, I don't think anybody really does that. So if you could talk about, like, okay, what's plastic surgery as opposed to other like cosmetic surgery things, and what does it entail?
Yeah, this is a really important concept. And one of the reasons why the medical boards like don't limit you is because they don't want to limit innovation. They don't want you to say like, oh, you can't do something even, just because it's like not currently defined as plastic surgery. Because look, we've got like robotic surgery and all this other stuff now. If we said, oh, like this is what a vascular surgeon is, this is what a plastic surgeon is, then it would really limit the potential for innovation. So instead, we're just expected to be ethical, do no harm, and try to help patients. But that really opens the door for like, what does that mean? Plastic surgery is a specialty. It is a specific field like neurosurgery, like dermatology, like cardiology. There is no such thing as a cosmetic surgeon in terms of this recognized specialties in American medicine. So if someone calls themselves a cosmetic surgeon, you got to ask further questions. Specifically, what are you board certified in? And that's where it gets really tricky because there's a club called the American Board of Cosmetic Surgeons, which is not a real board. It truly is, like we were talking about societies being a club, but that one also, it's a club. It's not a real board. So that's really, really important. You want to ask what they did their residency training in. I think that's a really key question to ask, even more than board certification, because of this kind of fake concept of being board certified. Ask what they did their residency training in, and then ask if they could perform said operation that you're inquiring about in a hospital setting.
Yeah,
Hospitals are very, very rigorous in terms of who they give privileges to because they do not want to have problems. They do not want to have lawsuits. They don't want to be letting they don't want to let you or I do neurosurgery there just as much as they don't want to let a dermatologist do breast augmentation. They're very conservative. So if your plastic surgeon or cosmetic surgeon can't do breast augmentation in a hospital, red flag. They have to have hospital privileges or they cannot be board certified by the American Board of Plastic Surgery. And if you're not board certified and you've been out in practice, then you can't be ultimately an active member in our societies. They'll rescind your status as a member. So that's really important. But that's how you find out. Because we say, oh, it's like easy, you're part of the club, but it's really hard to become a plastic surgeon. It takes a long, long time. It's years. I mean, it's literally minimum what? It's minimum 14 years, minimum post high school. That's if you take no breaks and do everything the most efficient way. A lot of people, it's going to be 20 years or even more. So that's why people like to take shortcuts sometimes.
yeah, I totally agree. And the key thing is, hey, if you don't know all the initials and what they mean, if your doctor can do it at a hospital, that's great. That's what you want. I rarely go to the hospital, but I still have to maintain my privileges at the hospital because I just do. We have to transfer patients potentially at the hospital. We sometimes are called in to see patients at the hospital. Well, you know what? You've been vetted. I've been vetted. We're part of the American Board of Plastic Surgery, which is why we're allowed to do so.
Yeah, and
So,
it's important that if something were to happen, it's important that you can go see your patient and still take care of them. If or sometimes a patient's maybe not in the best of health and you are doing a reconstructive surgery and it should be performed in a hospital because outpatient isn't the safest environment. So it's just important to have those options.
yeah. So, what do you think from our perspective as a plastic surgeon? What's going to happen in the future in our field?
Oh, it's so exciting. I mean, we see the rise of like ultimately like artificial intelligence and eventually robotic. I mean, I think we're a far way out from that, but I think when AI can start reviewing how we do surgery, reviewing like how we analyze spaces, I mean, they can assess symmetry and things like that. What's perceived as beautiful, which is kind of scary. We have to watch the AI. I mean, ultimately, robots will, I mean, we already see them now doing more internal surgery, meaning like around the organs, but I think that's like way in the future. Although, if we're all plugged into the matrix at that point, maybe people will be less interested in aesthetic surgery. Who knows? A rise of, increasing effective non-surgical options, like trying to make us kind of obsolete from a surgical perspective. Again, we're not there yet. Surgery is still king or queen. And then just always increasing outcomes. Like I think one thing that you and I have seen is just like how we've changed the medications we use, like how rapidly patients can recover now from these operations. Like used to have to be in a hospital and stay like multiple nights there, or maybe even be pre-admitted for it. And that's just not happening anymore. What do you see as upcoming exciting trends?
I think a big rise of non-invasives or less invasive stuff, because even, I love surgery, but I have to admit that a lot of the less invasive, non-invasive things, they may not stop surgery, but they're going to postpone surgery. So they're
Mhm.
going to postpone aesthetic surgery, facelift, other things. Innovations, for example, in rhinoplasty with non-surgical nose jobs, better quality skin texture, and things like that. We already have some of it now, and so it's going to increase. The other thing is regenerative medicine, where we're not just filling in a wrinkle. We're actually filling in a wrinkle and allowing the skin, the collagen, the dermis, the actual external skin to look better. So right now we can sort of do that with fat grafting, but there are products that are not from our own body that we can apply. A lot of this stuff is, I wouldn't say experimental. It's being done in outside of the U.S., so it's not being done inside the U.S. I don't know if we're missing much. That's a topic for another video. But regenerative medicine, the ability to sort of grow cells of a certain organ, like grow cartilage cells or liver cells, that
Mhm.
was great. Then we can actually grow an ear or grow a liver. That would be one of the holy grails for plastic surgery, organ transplantation, and so on. And it's a little weird that we're talking so much about stem cells, but stem cells are widely available in our fat. And who has better access to fat than you and me through liposuction?
Exactly. So I think we'll see more and more of regenerative medicine uses too, because again, it's like we would like to replace like with like, and what's better than your own tissues? So very exciting. And this is like the best is yet to come for plastic surgery. I'm very confident of that. Just every year, I think we just keep getting better and better. So I hope you all enjoyed the discussion, understand what it's like to become a plastic surgeon, what our day is like. I have students shadow in my office sometimes just to get an idea what the life is like. And I would imagine you do that too, or open to it. So if you have any questions about the journey, please comment below. We always love helping people, guiding in the future. I know you and I have had amazing mentors over our careers, and no one gets to where they are alone. It takes people looking out for you along the way. So exciting discussion, and stay beautiful, Dr. Kim.
Stay beautiful.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.